putting some kind of an artificial deadline to get this done. If it takes another month or two, it seems to me, or 3 or 4, the most important thing is to be right rather than to be quick on healthcare reform. But a public option is one of the things that's on the table.
Well, what about concerns brought up by the Congressional Budget Office that a number of businesses might drop coverage and we'll have all these people on the alternative that's being talked about? Is that a concern that we could have more people in this than we expect?
Well, this is something about doing it too quickly, unintended kinds of outcomes, unintended kind of consequences. You did this not understanding that because you did it this way, those things occurred as a result of having done something incorrectly up front. And yes, and that is a fear that many businesses will decide to drop coverage because it's more attractive for them to pay some kind of a fee, but that will force their employees to go into another kind of a program that they may not want, may not be as good as what they're getting right now. That's a real fear in developing a reform healthcare package. One of the things we talked about this morning was how important preventive care is. How we need to invest in seeing to it that people are kept well to begin with, because once people get sick, then of course the costs mount, and as well as their personal difficulties mount. That was huge. Another thing we talked about was the need to see to it that we develop more primary care physicians so that they can deal with people at the front end, and also primary care physicians to man our rural areas where we have that are underserved medically and that wind up propagating people who are not as healthy as they should be because they don't have any primary care, no preventive care, and then finally becomes very costly care. So we talked about that. Talked about how important information technology is. Of course, we're here at EPIC, and they've done an incredible job over the last 30 years in developing and modernizing information technology throughout our country, throughout the healthcare system at every level. And that has helped us to provide better care and more quality care at less cost than would otherwise be true. And the one thing that is true about the United States is that we're ahead of every other country in terms of information technology. But we're not ahead by any means of other countries in terms of delivering quality care at a cost that we can afford and seeing to it that everybody has access to health care. So there's so much work that needs to be done. And I'm pleased that we are, we're confronting it. And we're trying to deal with it in a way that I hope will be constructive and that I hope will begin to lead us down a path toward healthcare reform that really does address the problems that we have in this country in terms of delivery of healthcare, quality healthcare at a cost that we can afford, seeing to it that everybody has access to healthcare. At least you can say, at the very least, we're not sitting still. We're not looking backwards, trying to look forward. And I think in that sense, the process is beginning to unfold as it's meant to unfold, in the sense that what we need government to do is to confront the issues that really are vexing our country. And nothing is more important than the cost and availability of health care.